this is work that's jointly with a number of people from a number of institutions. SOAS, where I'm from, London School of Hygiene, Stanford Medical School, Sanjay Basu and his team, and our two Thai partners, one based in Bangkok and the other in Chiang Mai at Chiang Mai University. Okay, so I'm going to talk first of all about this class of problems. So we have a number of problems in the agri-food sector which are characterized by this triangle. They are, you have food systems at the center of it, and you have health along one side, the environment along the other side, the economy forming the third side in the triangle. So food sector aspects which have significant implications for health, environment, as well as economy. And there are a number of such areas. You can think of, for example, the livestock revolution in many countries around the world, especially in Southeast Asia, the rapid expansion of the livestock sector, which has brought many economic benefits. But there are certain implications for the environment, greenhouse gases, but also livestock waste and so on, which we need to think about. And there are health aspects as well. There's obviously good nutrition following more animal source food consumption, but that can tip over into overconsumption as well. So fairly complex, big challenges which span these three areas, and there's a number of them. And what is also quite important is that these big problems have implications at a pretty large scale. So the economic angle can potentially have an impact on the GDP of the country, so have a fairly large macroeconomic impact apart from for impacts for households and so on. The health aspects can apply to entire populations through the food system and the food supply, and likewise the environment can be at fairly large scales, greenhouse gases and so on. So it seems intuitive that we need more tools, more work that spans these dimensions at these large scales. Many of these problems are studied at a fairly micro scale, and that's developed a lot of understanding. But one argument is that there is a space for looking at it at the scales at which they are quite prominent. Palm oil is a classic example of this, and that's what we're analyzing in this case. Palm oil, Sol's already set the scene. In this graph, you've got the three dimensions. You've got the health or the nutrition dimension over here on the top. You can see a graph there, which is basically showing the fatty acid makeup of various kinds of oils. How much saturated fat, that's the red bit. How much polyunsaturated fat, that's the blue bit. How much monounsaturated fat, that's the yellow bit. So red here is bad. Blue here is good. And yellow is also sort of good. So that's the basic idea. So if you look at palm oil, it's the third from last. Lots of red, very little blue. So high percentage of saturated fats compared to polyunsaturated fats. And you can look at competing oils. There are many oils, prominent oils, which are further up the scale, which are much less saturated fatty acid content. Why is this important? Not just because of that, but the fact that palm oil is in everything we eat today. So chances are that almost everyone in this room has had some palm oil today. It might be in small amounts. It's probably in the biscuits that you eat in the morning for breakfast. It's probably in the instant noodles if you fancy instant noodles. It's in confectionery, baked goods. Everything has got palm oil in it. Instant milk products have palm oil in it because it's got certain food processing properties that are very attractive. So it is quite important. We've got the environment on the other side at the top. And this is just an example. This is from Borneo. This is Borneo. So you can see forest cover in Borneo sort of before and after palm oil became prominent. So you can see forest cover in the 1960s. By the time we get into the 2010, you can see what's happened to the forest cover. And by the time it's 2020, it's likely to have declined even further. Now, not all of this is because of palm oil. There's lots of other stuff going on in Borneo. But a significant amount of it is. So it can lead, doesn't always have to, we'll see in a minute, large-scale deforestation when it's run as large plantations in forested areas. But there's a reason why it's so successful and why it's so prevalent, and that's at the bottom. That's the economic story there. If you look at the yields of oil per hectare from palm compared to alternatives, there's a massive difference. Oil palm yields probably 10 times as much as oil per hectare as soybean or other competing products. So that's why it's so successful, one reason why it's so successful and why it's everywhere. So that is a problem. So you've got three corners of the triangle. all moving in different directions of desirability and undesirability. And how do you actually look at these trade-offs? Can we understand these trade-offs a bit better? And that's what we're trying to do in this project and come up with certain policy implications for that. So the research questions have to do with the health, economic, and environmental implications of policies to reduce palm oil intake or manage the edible oil sector more generally. And what is a viable strategy for improved outcomes from the edible oil sector more generally? So can we think of a strategic approach for the country that we're studying in this case, which is Thailand? Now, just a word about Thailand. The reason we focus on Thailand, it's the third biggest producer of palm oil in the world and consumer of palm oil in the world. But it's much, much smaller producer and consumer, smaller producer than Malaysia and Indonesia, which are the giants in the world. Thailand is largely self-contained in terms of its palm oil consumption production. Not much trade happens, partly because they control the sector very, very carefully. Palm oil is identified as a nationally important product in Thailand, and there is a price ceiling on the amount that the retail price is capped at a certain level. So the price is not allowed to go beyond a certain level, and that's set by the government. So that's a challenge. So the methods, we have a gigantic model. So this is a model to address the entire system in its big scale. So you can see so here in this model we have a policy shock at the top which affects palm oil. It could be taxes, subsidies, whatever else. There's a demand system. This is a computable general equilibrium model, a macroeconomic model which looks at things like labor, which looks at various aspects of the economic aspects of palm oil around the macroeconomy. And there's a demographic model, there's a health model which is built in, which translates nutrition consumption into health effects, cardiovascular disease outcomes, and so on. And that translates into demographics, mortality, morbidity, health effects, and then thereby into health costs and things like that. So you get a series of effects at the bottom at the macro scale, and that's the model that we've been building over the last few years. We've also got a suite of stakeholder analysis that we've been doing. What are the prospects for health and environment-focused palm oil reform? And so we interviewed a number of people. So this is a mixed method study with the two aspects informing each other. I'm just going to show one scenario from our modeling. We've done a number of scenarios. This is a 50% reduction in palm oil applied through a taxation of palm cooking oil in Thailand. Then that feeds, once you have that policy shock, that changes the demand for, that changes consumption of palm oil as well as substitution of other oils for palm, but also other foods within the food system. That translates into exposure to health exposures in morbidity and mortality. That translates into other aspects of the macroeconomy. That translates into land use and everything else. So just that picture we saw from before. And here's some very basic results from this. As you see, a tax which reduces palm oil consumption, cooking oil consumption by 50%. You can see the change here. The saturated fatty acids over here. That's the green. That's negative, so that declines over time. So we're forecasting into 20 years ahead. The blue stuff is the blue line is the polyunsaturated fatty acids, the good stuff, and you can see that's positive over a period of time. When you look at the biomarker, which is the change in total to HDL cholesterol, so that's the biomarker for the health impacts from which you can pick up things like morbidity and mortality. You can see over a period of time a 6% decline in that ratio, which is a good thing. So that captures very quickly the health and nutrition impacts of this policy. The economic impact, well, this results in a $14 billion increase in GDP in Thailand, cumulative over 2016 to 2035, of which 11 billion is change in household consumption. So we are basically implementing a revenue neutral tax policy. So it's a taxation of palm oil, and there's an income transfer which is given back so that we keep the policy neutral in the sense of households receiving something back in terms of their budgets. So you have a 14 billion boost to the real GDP, and that's the bottom line. What happens to the environment? Now so the story is not always what we assume it's going to be. And in the palm oil case, you can see the environmental impact. One reality of the situation in Thailand is that palm oil oil palm is grown on small and marginal lands by smallholders. It's a big difference compared to Indonesia, Malaysia, other producers around the world. And this makes a big difference. So when palm oil is actually taxed and oil palm production is reduced as a result of the tax, what essentially happens is that oil palm is substituted with things like rice or rubber, competing crops that might grow on these marginal lands. These are fairly marginal lands on which it grows, oil palm. And therefore, the actual carbon sequestration of oil palm is higher than the carbon sequestration of those competing crops. And as a result, the taxation actually results in not a positive environmental effect, but a small negative environmental effect, which was something of a surprise, but shouldn't really be given the makeup of the oil palm sector in Thailand. So the stories are not always what you assume them to be when you start off. That was a lesson that we took away. But we are now asking the question, right now the model that we construct is assuming that agricultural land stays fixed, that we're not spilling over into forested land and so on, because that's not been observed so far in Thailand. But what if that happens? That's something we're investigating. The stakeholder analysis tells us that the economics of it is absolutely vital. This sector is being managed for its economic viability, for its economic returns. And that is the bottom line. There's a National Palm Oil Committee which regulates the entire sector, which caps the price of cooking oil, and also subsidizes the producers if the prices fall below a certain level, controls imports. It's tightly regulated purely for the economic benefits that it provides. The health sector is not represented in palm oil decision making in Thailand. It's not even consulted. So that's the weak influence of health sector in policy making. What is happening increasingly is that oil palm is being used more and more for biofuels rather than the food sector, which is an interesting development more recently. In case of the environment, all the people we spoke to are very clear. Thailand is not Malaysia or Indonesia. Do not assume that it will be like that. We've controlled it. We've kept it out of the forests. We've kept it in agricultural land, marginal land, and that's what we want to do. And whether that actually continues to be the case remains to be seen. But the private sector is seeing opportunities all the time. Now we have several good examples. Frito-Lay, for example, in Thailand, is moved out of palm oil and has moved into rice bran oil, which is perceived as a healthier cooking oil. So the private sector is looking at the writing on the wall about health impacts and environmental impacts, and it's actually starting to move up. So it's an interesting dichotomy between how the government views it and how the private sector views it. So, to conclude, there are economic and health gains to be had by limiting palm oil for food use in Thailand. Innovation is going to be key, because replacing palm oil is not an easy business, especially because industry is so adapted to it and consumers are so adapted to it. But it can be done. Innovation in the edible oil sector will be key. Biofuels, where the future in Thailand is, and moving out of food use into biofuels use might actually be a beneficial thing, but that's something we're hoping to find out a bit more about in a follow-up to the modeling that we've been doing in the project. It's clearly critical to keep oil palm within agricultural land, because the minute you spill over into forested land, that carbon sequestration, those numbers go haywire, and then you get large-scale environmental negative impacts. So that's absolutely critical. So I'll stop there. Thank you.